Hey guys, welcome back to my channel. My name's Jessica Ward King, also known as the Stigma Crusher. And here on this channel, we deal with issues of mental health and mental illness from my twin perspectives as a person with lived experience of bipolar 2 disorder, as well as a person with a PhD in experimental psychology. Does that sound like your jam? Please join us. We would love to have you. Go ahead and hit that subscribe button, and if you would like to be notified every single week when I post, you can hit that notifications bell as well. Please remember to widely spread and like this video. And without further ado, I guess it is time to start stigma crushing for this week. Okay guys, so this week we are going to talk about something I find really interesting, which is lithium and lithium toxicity in particular. Now, we know that medications are very important tools and that cannot be played down at all. But sometimes there are going to be side effects. Actually, most of the time there are side effects. If too much gets into the system, kind of depending on the medication itself, there can be toxic effects, and lithium is one of those that can really rapidly become toxic. But it's really, really important to never discontinue a medication without your physician's or another physician's advice or approval. There can be kind of a sensation of, oh no, I think I'm having a weird side effect. It might be a weird side effect that goes along with toxicity. I should just stop it. But that is not the case. If you feel like you are, these symptoms that we're going to talk about today sound like your situation, then by all means get yourself to your doctor, to a clinic, to the hospital, depending on what time you're at and where you are. But do your best to continue to take your medications as prescribed, because quite often going off them really fast or abruptly can be bad for you as well. So what is lithium? Well, to start with, it is an element, so it's the third element on the periodic table, which means that it is the third most frequently found in the universe, which is kind of nice to know. You will never run out of your lithium. But it's also a really naturally occurring compound in salt. In the case of the lithium we take, it's lithium carbonate, so it goes with carbon atoms. Its claim to fame, generally speaking, most of the world when they hear lithium doesn't think, oh yeah, lithium, the medication. And most people think lithium, oh yeah, like in my batteries. Like all of our batteries, the little, round batteries, the AAAs, AA's, all those, but as well our lithium ion batteries in our devices. So we all have a bit of a stake in lithium, to put it mildly. It's really, one of the interesting things about lithium is how it was discovered. Not lithium, the actual compound, that was discovered in Australia in mines in, I believe it was the 1800s. But lithium, as it's used for medication, was found and I guess you would say claim to fame was created by John Cade. John Cade was also an Australian, just kind of incidentally. He had colleagues in other countries as well, but he was the first. And so John Cade, he was literally doing experiments in an old rundown kitchen of some sort on the grounds of a psychiatric institution in Australia. And he was getting, this is a little weird, he was getting urine from the patients at the hospital and putting that into the bowel cavity of guinea pigs. And what he found was that they were getting worse when they had the urine of those patients who were manic or had bipolar disorder, then called manic depression. And there were kind of a couple of weird leaps of logic where he said, well, I've got to balance the urine. And so one way I can do that is by putting lithium carbonate in the mixture. And he found that these guinea pigs were more tranquil and were actually probably suffering from early stages of toxicity, but it looked like a good outcome to a psychiatrist who had an entire hospital full of patients that he had nothing to treat with. They literally had no medications at this point to treat the patients with. And so he's like, hey, makes them more docile. It doesn't make them worse. This is sounding like a good option. He tried it on himself before he tried the lithium on other patients because he wanted to make sure he got the dose right. He noticed that some of the guinea pigs did not survive the trial, and he wanted to make sure he didn't kill any of his patients, which was actually admirable considering. And then once he had the dosage kind of sort of figured out, he started using it on patients. And his first trial with 10 patients with manic depressive disorder or bipolar disorder, they were amazingly improved, like overnight normal kind of improved. And it was absolutely gobsmacking. And so then he tried it with other classes of patients, so those with dementia praecox, otherwise known as schizophrenia, and those with depression as well. But he found that the best outcomes came with those treatments on patients that had manic depression or bipolar disorder. And so it was found lithium carbonate worked wonders in bipolar disorder. And so you think the man would be absolutely rich, right? Like this would have been the biggest find ever, one of the very first drugs that they ever used. It was followed very quickly by drugs for schizophrenia and depression, but it was really one of the very first. But it didn't get anywhere. Why? Because you can't patent lithium. It's an element. So Big Pharma couldn't make money off of it, essentially. It took years, decades in some countries in order for lithium to ever be brought into their classifications to become an actual medication used for mental illnesses. It took this was discovered and found in 1949. And it took until 1970 before the United States got on board with allowing lithium to be a medication. I'm not a big pharma, pundit or anything, but that is news to me and quite shocking. So we're now at the point where we know that lithium works really well in people with bipolar disorder. It's one of the things that works particularly well because if you give someone something as an antidepressant who has bipolar disorder, they start to cycle. They will go, from antidepressant to mania and start cycling. You need to give them something that's a stabilizing element, and luckily lithium was just the thing. But since then, we've discovered that adjunctive therapy for depression, so when you have an antidepressant on board and it's not quite working, not working enough, you add lithium, boom, it's magic. And so that's actually the most used way that we use lithium right now. It's off-label, so it's not the way it's supposed to be used, but we know it works extremely well. So that's another thing that lithium can do. What can lithium not do? So talking about toxicity then, lithium toxicity is something that happens when you get too much of the lithium stored up in your body, and now you can't get it out fast enough, and it starts to cause toxic symptoms within your body. So how would this happen? Well, it could be intentional or accidental overdose. So that could look like taking your dose of medication twice when you didn't remember that you'd already taken it and you just take another one, or even 3 times. Or that could be intending to die by suicide by taking extra lithium. Extreme weight loss can also do this. So like, for example, through a gastric bypass. And I can speak to this because I ended up lithium toxic because my psychiatrist and I didn't somehow factor in that, oh yes, I'm losing all this weight really, really fast. That's going to cause a difference for all of my meds. Until, I ended up not feeling well and ended up at my local emergency room, and they took blood, found that there was so much of excess lithium, and we had to proceed to get rid of it. So extreme weight loss definitely can do it. Don't ignore that as a possible symptom. Dehydration is another one. So because this is a salt that we're talking about, anything that can change the concentration of salts in your body can cause lithium toxicity. So that could be via vomiting, diarrhea, by kidney problems if you happen to have or start having kidney problems, a low sodium diet. It could be like dehydration because you are going hiking, or you are in the desert, or any of those ways that you get dehydrated. And sunstroke or heat stroke can also cause lithium toxicity. That's another of my claim to fame, is that I have received lithium toxicity because of heat stroke. And so that heat stroke causes dehydration. It caused, vomiting and diarrhea and all of these things that could then change the concentration of the lithium in my body. So when you're taking lithium, then you have a regular dose that keeps your lithium within a therapeutic range, and you can get the symptoms even if your levels are maybe not quite in that range. And you can, of course, there can be mild, moderate to very severe cases of lithium toxicity. Generally speaking, what are you going to feel like? What are the symptoms going to be? There's going to be confusion, potentially. And again, not every single one and not into the varying degrees, but just hear me out with my list here. So confusion, an increased heart rate, low muscle tone, so kind of feeling weak and floppy, coma, seizures, that's kind of the severe end, right? The coma and seizures. Low blood pressure, stomach pains, vomiting, diarrhea, as I mentioned, fatigue, and tremors or uncontrollable movements. In really severe cases, you'll see agitation, slurred speech, kidney failure completely, hyperthermia, delirium, and it can result in death. So lithium toxicity is big deal. It's not something to shake a stick at by any stretch of the imagination. So it can be quite scary. So when there's this risk of lithium toxicity that can result in all those effects, why would we continue to take it? I mean, surely there are other options, and there are other options, like lamotrigine, for example, is another option as a mood stabilizer in bipolar disorder, and it has those effects in depression as well, as I've mentioned. So why would we do this if the lithium toxicity can be so bad that it leads to death? And I should mention, can kind of really easily happen. It doesn't have to be that you've taken an entire handful, or that you've been through the desert on a horse with no name. It can really be very mild perturbations in your body or in the way you're taking the medicine that can cause the toxic effects. The thing is that lithium really does work. It is very inexpensive, partly due to the whole idea that Big Pharma can't patent it or anything, but that does result in a medication that is quite inexpensive. And when you consider the amount of folks that do need to take it and who have significant issues in terms of being able to work or feeling well enough to keep a job, it's important that we have medications that are inexpensive. It works really well in bipolar, as I've mentioned, but also in depression and in other conditions. This medication is added as an adjunct to help, and it is really effective. So it can do a lot of different things for very inexpensive. And the other thing is that it works for mania. So when a patient comes to the hospital and is manic, then we know they have bipolar disorder, but what they're presenting with is mania. it's really difficult to treat. But one thing that does work is lithium. So there are some really big positives to taking this medication. So the negatives of lithium and taking it, the first would be toxicity, which is fairly rare, even though I'm saying like it's very possible for it to happen without intent and very quickly. But it's also not extremely common that people are just, getting toxic and dying of toxicity from their lithium doses. The side effects actually tend to be pretty tolerable, and they tend to be the common ones. So like headache, nausea, maybe some vomiting, diarrhea, dizziness or drowsiness, appetite changes, either, eating more, eating less, hand tremors. I mean, that one, the hand tremor is one that's causes most distress to a lot of people. But in general, the side effects are pretty mild and pretty tolerable. The one thing is you'd have to have a lot of blood tests. The only way they can tell how much lithium is building up in your body is by doing a blood test, a simple blood test, the kind you go to, to the bloodletting place. They put the needle in your arm, they take some blood, you're done. Like it's not anything, it's not a specialized blood test. But they, especially when they are trying to titrate it up into your system and figure out, where is it working for you and where is it safe for you, they'll have you doing blood tests sometimes every couple weeks, sometimes more frequently, just depending on you and your doctor. So that can be a bit of a drag, and particularly if you are afraid of needles, that can be really a drag and possibly prohibitive. If you have kidney disease, it's not for you. Heart disease, it's not for you, because irregular heart rhythms can result. So there are a couple of conditions for which it would not be admissible to have lithium treatment. But all in all, we do know that lithium is effective. We know that we've got to follow the doctor's orders very, very carefully, but also listen to our bodies. And if you're finding you're having the effects that we talked about, to definitely have yourself seen immediately. Don't wait. Never stop all meds without the doctor. I know I said that earlier, but I cannot be too much talked about, that folks take it under your own desires to stop a medication, and that can actually cause more harm than it does good. Just stopping a medication can often cause the body to react very badly. So definitely don't stop the meds without a doctor telling you to do so. Do get all your blood tests. Do keep an eye out for toxicity, especially if you're having any of the conditions that you're going to be in, any of the conditions that we talked about. So, anything that changes, like dehydration, that changes the salts in your bodies. So if you find that you've had heat stroke, you may want to get yourself checked out. If you find that you have been, you've been ill and you've been vomiting and you've had nausea and you've had diarrhea, that you may have lost a lot of, salts in your body, and you may want to get checked out. So keep those things in mind, particularly when you're thinking about the toxicity kind of criteria. And I guess the last thing I have learned from doing this video is do not experiment with urine on guinea pigs. I mean, I guess do, because he got the job done. He figured out lithium. He got the paper into the journal, the psychiatric journal. That got his colleagues in Finland and in the United States and elsewhere to jump on the bandwagon with him and say, yes, we found this too, which, then eventually got it as a medication that could be used on the hundreds of thousands of patients with bipolar disorder who really, really needed something that would work even on their manic symptoms. So I guess the guinea pig thing got the job done, but I'm going to stand by that recommendation. No urine in guinea pigs. Just don't do it. All right, guys. Thank you for being with me today. I've loved to share with you about lithium and lithium toxicity without trying to make it too long. So if you want to hear anything else on this topic, leave it in a comment down below. I always love hearing your comments and will always respond to them. And if you have any other ideas, if you became toxic with lithium in a weird way or just wanted to share your experience, please do hit me up in the comments down below. Share widely, please. There are lots of folks that could join this community that just don't know it exists yet. So please do share and like. And I will love to see you again in our next video. Take care. Bye. Stigma Crusher.